my pleasure to just tell you a little bit more about the landscape, the national landscape in maternal mental health, what's been happening in the last several years. So I always like to start with a few statements. I like to start with these "did you know" comments. Did you know that women in their childbearing age years account for the largest group of Americans with depression? Did you know that the American Academy of Pediatrics has noted that the prevalence of depression and anxiety in teen girls is skyrocketing? Did you know that maternal depression is the most common complication of childbirth? That's without the other disorders like anxiety, psychosis, PTSD. And there are more new cases of mothers suffering from maternal depression each year than women diagnosed with new cases of breast cancer. And despite all of this and the large prevalence, maternal mental health disorders still go largely undiagnosed and untreated. And that's why we're here. I also wanted to start by just talking about the words that we use. And why does 2020 Mom use the word or term maternal mental health? And I know all of you know that there are other common terms like postpartum depression or PPD. This was the disorder that was first researched, and there's a large body of evidence around postpartum depression, and for that, we're grateful. But we also now know that depression and other disorders can onset during pregnancy as well, and that there may also be pre-existing untreated depression, anxiety, etc., that exist prior to pregnancy. So postpartum may not be the right term to use when we're defining this time frame. We also really think that, and have heard from various mothers and providers, that there's this notion of do no harm, that we can't use the term postpartum depression as an umbrella term if we're really referring to the range of disorders, as it can confuse not only moms who may not be suffering from depression, but perhaps anxiety or psychosis with waxing and waning symptoms. Depression is not helpful in that sense. You'll also hear the term perinatal mood and anxiety disorders, which is often used by clinicians. And what happened several years ago, actually on this stage, is we learned that our fellow organizations, including Mental Health America and the National Alliance for Mental Illness, that any acronym, if we're going to use an acronym, which most of us do when we use this long term, any acronym that uses the word MAD in it is just a no-no. So you're going to start to see, and may have already seen, a movement away from that term, at least when we're talking with the public and mothers. So what about maternal mental health and maternal mental health disorders? This is why we started using this terminology at 2020 Mom, and so many others are as well. It's easier for clinicians and non-clinicians to understand what we're talking about. It leaves out no disorder or time period, and it also offers hope. I'll also just quickly share that we focus on maternal mental health, but also want to acknowledge that fathers can suffer from these disorders as well, and additional efforts need to be made to support fathers. I wanted to share just a little bit of background because I don't know if all of you, all now 900 of you, know that we have issued, with support from partners, including a funder, the California Healthcare Foundation, and many experts from around the country, issued what we called State of the State reports in 2017 and 2019. These reports included background information, which you can see up on my screen now, including the range of disorders, the period in the middle that we need to be thinking about, and also important information about barriers to care and pathways to change. Wanted to make sure that you're aware of those reports because much of what I'm about to share next is actually anchored in these two reports. They included both federal and national data and background information applicable to everyone, and they also focused on some of the work that was happening in California. This might be helpful to those of you outside of California as well if you're interested in doing more work at a state level, and we're interested in supporting you if that's the case. So let me start by sharing what we believe. And this is really what you would see if you unpacked these reports, first off, there's no simple answer, right? Or we all wouldn't be here. There's no simple answer. And what we really believe at 2020 Mom, and one of the things that I think our expertise lends itself well to, is that we believe the healthcare system should work. If all of us who have coverage or are supporting coverage of new moms of healthcare benefits and mental health care benefits, we believe that the system should work for us. We're paying into the system either through our employer coverage, private coverage, our personal pockets, society, and we believe the system should diagnose and treat. If we're paying for this coverage, the system should work. We also believe that there's a real urgency around addressing treatment shortages, that what we often hear that all we need to do is screen, screen, screen. Well, screening can't happen and doesn't happen without appropriate referral pathways and support for screening providers and those who screen positive. We also really believe that treatment shortages of reproductive psychiatrists, the reports that I just mentioned highlight in the US where we have gaps in reproductive psychiatry. Thank you to our partner, Postpartum Support International, for helping to lift up those gaps. We believe we need more reproductive psychiatrists, those with specialized expertise in treating women in this time frame, and also therapists who are qualified and certified peer support specialists, which could include doulas who are trained and able to support women during this time. We also believe, like I know all of you do too, that obstetricians, which are the home base for primary care during this time, and we mean both OBGYNs and midwives, obstetricians. It can also include family practice doctors who are delivering babies, which still does happen, particularly in rural areas. We believe obstetricians should have increased capacity to support not just diagnosis and treatment plan development, but also treatment for mild to moderate depression and anxiety and what that might look like. The next pink line talks about the fact that providers must be educated and tested to do no harm. Last year at the forum, one of the providers on stage said, if you're not trained, you're actually doing more harm and you don't know it. And so providers, we find, don't know what they don't know unless they've been exposed to this topic. We also believe that it's really important for proficiency to be tested and these types of things to be baked into board certification, including the ABOG board certification program for obstetricians or OBGYNs, for example. I also feel like I need to give some great credit to Postpartum Support International at this time for developing a credential for therapists and other providers, mid-level providers, to become trained and tested for proficiency. Thank you, PSI. And then the last thing on this slide is to talk about the key role of payers, so health insurers and Medicaid health plans, and hospitals in scaling change. We use the term hospitals as the hub of birth. In the US, whether we like it or not, hospitals still deliver 99% of babies in this country, and so really can play a key role in educating moms, families, and staff, and also MDs and obstetricians in the community. We also believe that insurers have an awful lot of levers that they can push, including incentivizing desired actions. Do we want to see screening? Well, how do we make sure that providers are made whole for those efforts? Quality monitoring. How often are providers actually screening for maternal mental health disorders? And building adequate mental health networks, which we often hear is a significant problem in mothers and others having to go outside the health plan system to get care. All that to say, that's the healthcare system. There's work to be done, but we also recognize, and I know all of you do too, that we need to move upstream to provide social and practical support as well in addressing social and practical determinants of health. We'll be talking about social determinants of health tomorrow on another panel. I can't wait to hear all of those experts dive into this more deeply, but essentially what we're saying is it doesn't matter if we treat the top of the tree if we're not treating and preventing problems underneath at the root. So what do professional and clinical associations say about maternal mental health? This is helpful for all of us to get background. And essentially, the highlights are everyone believes that this is important, all professional and clinical associations. And we first have to applaud the American Academy of Pediatrics for recommending early on in their Bright Futures recommendations that pediatricians be interested in the postpartum period in mental health and help women become aware of any struggles and help them connect to treatment resources. There's been an effort to increase screening rates among pediatricians as well, which we applaud, and it all started because of the American Academy of Pediatrics. The American College of Obstetrics and Gynecology, a great partner of ours, and all of the other nonprofits and leaders in this space, in 2017, rewrote their position on maternal mental health or postpartum depression at the time, and now recommends screening happen for depression and anxiety. The point about anxiety was made even clearer more recently by ACOG, at least once for those disorders during the perinatal period. They also, and you'll get to hear more about this on Friday, they also reissued a position on redefining and redesigning postpartum care, the fourth trimester, to expand to meet a woman's needs beyond just that one visit postpartum or two for a C-section. Again, you'll get to hear more about that on our final panel on Friday. And so you all have heard about the U.S. Preventive Services Task Force. This is the task force that was put into place with the Affordable Care Act 11 years ago. And this task force is asked as a part of health insurers covering preventive services. The task force is asked to review all the literature around preventive health services and identify which research shows that there's a need for a preventive screen or preventive service so that insurers have to cover it at no cost. So the U.S. Preventive Services Task Force did come out shortly after ACOG updated their position. Thank you, ACOG. We think one thing had to do with another. And they now recommend that pregnant women be screened for maternal mental health disorders and postpartum women as well. They also came out shortly after that point to recommend that treatments for prevention of maternal depression and screening to see who's at risk be covered by insurers. This is a great step in the right direction. In a minute, though, you're going to hear from me that this isn't enough to change the landscape and actually help make these things happen. That's a great segue for me to share with you. The Agency for Healthcare Quality and Research, AHRQ, shared in 2019 that for all adults, not just those with maternal mental health disorders, we're still really seeing a lack of screening happening for depression. And this despite a recommendation that not just for maternal mental health, but for the general population, that providers screen for depression. So let's move on to what about insurance and these recommendations that insurers cover these screening activities and even prevention of maternal mental health. So first, I want to just acknowledge that the Affordable Care Act turned 11 this week, and it is the reason why so many more people have coverage now in the United States. That's important. And we think this is foundational, that healthcare coverage should absolutely be available to all women. And I like to use the analogy of a fire department. Fire department's available or a fill-in staff for a fire department in a rural community. If a woman's house was on fire, someone would come help. And we believe that a doctor and mental health treatment should be available too for her. And that coverage should be there if her mind is on fire. It's foundational, but it's not enough to ensure that the system's going to work. So states also now, as of just a few weeks ago, can more easily extend Medicaid for pregnancy Medicaid, the pregnancy Medicaid population. This is essential as Medicaid would term at 6 weeks postpartum and still is terming for so many women at 6 weeks postpartum. Half of our population in the U.S. is insured or receives coverage through Medicaid. And so now with the support of, you can read this blog post snippet on the side of my screen, with recent support states will now be able to receive a federal match to extend postpartum coverage through 12 months postpartum. So women who are suffering from maternal mental health disorders are more likely, hopefully, to be screened because their providers won't be afraid they won't have access to treatment, and then, of course, have access to treatment through this extended Medicaid coverage. You've already heard me say it, that coverage matters and these positions by associations matter, but it's not enough to ensure that the healthcare system is going to work. There's no universal system of care or standard. We're really leaning on independent providers to be trained and informed about these disorders on their own time. We always say there's no Starbucks infrastructure. It's not predictable everywhere you go. It differs depending on where you live and who your provider is. So one more statement that I want to share. We all know that it's important to measure what you treasure, and that in our space for so long, we weren't measuring screening rates or even measuring rates of suicide among the maternal population. There has been some great efforts happening on both of those fronts, and today I'm going to cover a little bit about screening. So those associations and the U.S. Preventive Services Task Force recommends that screening be covered by insurers. It is covered by insurers. That's happening. It's just that screening still isn't happening. On the next panel, you'll get to hear our colleagues talk a little bit about some of the things we can do to see that change. We talked about already the fact that only 35% of adults have been screened for depression outside of our population or inclusive of our population, even in the latest reported data. There's also another set of data that showed from the federal government that showed primary care providers are screening the adult population or adolescent and adult population just 8.5% of the time. So regardless, the data that you see still is showing that there are significant gaps in the overall population for screening of depression, anxiety, et cetera, and that there's no difference really in what we're seeing for our population, according to the research. Those of you that attended the forum last year got to learn about a new initiative that was funded by two of our sponsors, the Zoma Foundation and the California Healthcare Foundation, to fund a new HEDIS measure. And a HEDIS measure is what's used in the health delivery system to monitor how often either screening for something is happening or testing or even treatment is delivered. So it's really the gold standard of learning whether or not actions are being taken in an appropriate way. A measure was developed thanks to these two funders for pregnancy and postpartum screening, but testing is still underway, and we're hearing that that it's not been so helpful right now. The number of providers that are reporting screening has been low, et cetera. That could be in part because of COVID, but sadly, we're going to have to wait a little bit longer to see a national data set on screening rates. Finally, I'm going to wrap up with talking just a little bit about COVID and maternal mental health. As we all suspect, and as we heard from Teresa, there's really been very much in the headlines, in the news, and also through her study results, an increase in women reporting rates of significant anxiety levels or significant clinical depression. One recent study showed that rates of women reporting levels of clinically significant depression or anxiety are at 72% or 41% respectively. So significant increase from the 1 in 5 or up to 20% that we typically see. I also think it's really important to note that even prior to COVID, we would see substantial variances in the number of women that are struggling, particularly Black women at clinical rates at double the rates of white women who are suffering from these disorders. But Black, Latina, and Indigenous women now, because of COVID, are being impacted in even greater ways. You can see that there's lots of things at play here. Social support and isolation, economic consequences, perhaps increase in abuse at home, which we first saw, the research indicated was not happening, and there were lower rates of potential abuse at home. That's now not the case, we're learning. There's also this perception of risk of contracting COVID or my baby, whether it's real or perceived. And then problems with accessing healthcare delivery. We wanted to identify what came out of another report that called for really using this time of COVID to springboard into change to address maternal mental health. And that prior report, which was cited on the last page, talked about 5 S's being really cornerstone to the work for springboarding change. We added 2 of them here to these puzzle pieces. You can see we're talking about support, and we put this first, that practical support is paramount. You can't do anything else without additional hands on deck and support for sleeping, etc. Social support. So I have a family at home that can support me emotionally, physically, etc. Self-care, so I have the capacity to get exercise, like we heard from Amy as being so important to her healing. Screening, we've already talked about. Systems integration, the next panel will unpack this a little bit, but how do we further integrate mental health, including payments of mental health services, into primary care and hospital settings? Stepped care, what we mean by that is how do we help moms in a way that's efficacious and also cost effective, meeting her with exactly the right type of care she needs at the moment. That might be the use of a certified peer to support her if she's struggling early on. It might be inpatient hospitalization, and we know we don't have enough hospitals that can support that level of care, but it looks at a stepped care approach to get mom exactly what she needs at the time. And then the last one that we love is this research body, shared smartphone-enabled services. We're really talking about tech solutions. I just want to say thank you. We're all in this together. It takes a village. It takes a group of change agents like you to start to unpack and move the needle, even if it's slowly but surely.